Good afternoon and welcome to Thundermist Virtual Baby Shower Series. Today we have our very own Dr. Jessica Johnson and our Dr. Odinaka Anyanwu here to discuss on how you can navigate through your fourth trimester and what might be different during COVID-19. First, let's talk about exactly what is the fourth trimester. Not everyone is familiar with this period of time. However, all parents and their sweet little babies will be experiencing this. So the 12th week period right after your baby is born is what we call the fourth trimester. So during this time, your baby is starting to adjust the life outside the womb. So there are a lot of changes that parents and babies experience and a lot of questions that come around that time period, and it's not truly discussed a lot of times. So today we have some excellent prenatal providers here to answer some of the most common questions related to the fourth trimester. Please note that this is a live event and our providers are here to answer any questions that you may have. So please type in your questions right in the comment box and we will do our best to answer those questions for you, okay? But before we start Q&A, Thundermist would like to recognize Neighborhood Health Plan of Rhode Island, United Healthcare Community Plan of Rhode Island, Tufts Health Plan, and Landmark Medical Center for generously sponsoring these series. Thank you for making this possible. We're also very excited that we have here with us today from Neighborhood Health Plan, which is one of our amazing sponsors, a few people here explaining how you can be entered to win some grand prizes. Erica?
Good afternoon, everyone. My name is Erica Moore, and I'm the Sales Marketing Associate.
Great.
Hi, my name is Rosemary O'Brien. I'm a health and wellness specialist at Neighborhood Health Plan. Thanks for having us today. And Thundermist, thanks for having these great baby showers. They're awesome. So I just wanted to talk briefly about Neighborhood. I just wanted to let people know that we have nurse care managers who can help you manage your prenatal care, your postpartum care with your doctors at Thundermist. We have a nurse advice line, so you can call 24 hours a day, 7 days a week if you have a question or a concern. And we have member rewards, so you can get gift cards for having prenatal visits, for having your postpartum exam, for having a well exam. So that I just wanted to tell you a little bit about Neighborhood. I also want to let you know how you can enter the raffle for grand prizes. What you do is you watch each session live or recorded to get the link to enter for the prizes, and they're going to share the link in the comment section at each session. You can view until Sunday, May 16th to enter to win the prizes, and the winners will be notified by Tuesday, May 17th. Be sure to enter and be sure to enter your information correctly. And Marilyn, back to you.
Thank you so much. We really appreciate you coming here with us. And we have the link right below. So please take part in this. It's really amazing. And it's always fun to win some prizes. So please join us. All right. So before we begin, I would like our amazing prenatal care providers at Thundermist to please introduce yourselves.
Hi, everyone. I'm Jessica Johnson. I'm a family physician. I work in the Woonsocket office at Thundermist, and I take care of families. So that includes women in pregnancy, before and after pregnancy, and newborns. And I also do deliveries in the hospital.
Good evening, everyone. My name is Odinaka Anyanwu. Similarly, I'm also a provider at Thundermist Health Center in Woonsocket. I also provide primary and prenatal care at Thundermist.
Thank you. Well, let's get started. All right, so Dr. Johnson, this one's for you.
All right.
So we're going to kick off with a big question, okay? What are the best ways for families to stay safe after bringing their sweet little baby or babies home? And can they still see family and friends?
Yeah, very important question because, you know, we're still in the pandemic. So the best way to stay safe is something that hasn't changed. It's something that we talk about called cocooning, meaning the best way to keep your baby or babies safe is to keep everyone around them as protected and safe as possible. One of the best ways that you can do that as a parent or a caregiver is to get your vaccine. That really helps keep COVID out of the household as much as possible, since we don't have that option for babies yet. As far as whether they can see family or not, is really a question that sometimes is best answered on an individual basis. So certainly we recommend that families, to the best of their ability, are staying in their family groups. So household members, people who live in the home around the baby, again, should all, to the best of their ability, get vaccinated, wash your hands around the baby. And if you have any symptoms or you're exposed to COVID, wear a mask when you're around your baby as well. If family members, if there are like bubbles that you've created with your family members, and those bubbles, like grandparents, have been vaccinated and are following precautions that you as a parent believe are safe, then you may choose to have limited number of family members meet your baby. I think your healthcare provider would caution you to expand that circle too large, even with people who are taking precautions, who've been vaccinated. We know that there's still the risk of exposure. And so really limiting the number of people who are around your baby at this time is the best way to keep them safe.
Great, thank you. All right, so Dr. Anyanwu, if someone, per se, the parent did not get their COVID vaccine while they were pregnant, how can they protect their family now that the baby is here?
Great question. And so the good news is that even if you haven't received the COVID vaccination while you're pregnant, studies have shown that it is actually safe to get in the postpartum period. And so you can receive this vaccination even if you are breastfeeding. There are also studies to suggest that the antibodies can actually be passed through the breast milk. And so you can be providing protection to your baby as well. And so I'd recommend talking to your provider about that if that is something that is interesting or you'd be interested in. I certainly echo Dr. Johnson's sentiments. You can protect your family by limiting the exposure to other family and friends. I certainly would encourage your family and friends to not only get the COVID vaccination, but make sure they're up to date on the flu vaccination as well. You can also talk to your family and friends about vaccinations, Tdap or the tetanus shot as well if they're not up to date.
Great, thank you.
You're welcome.
So vaccines, very important. So Dr. Johnson, why is the fourth trimester an important time for parents and the baby?
This is such a big question. There's so many things that go into those first 12 weeks. So both for parents, for babies, and for that relationship as well. So one of the big things that I think many parents notice is there's a lot of changes in your body. So your body has just spent 9 months, presumably, growing, building this baby. And then there's kind of a process after where it goes back to a non-pregnant state. And really working with your doctor or your provider in that time to make sure that process is happening appropriately and that you're not getting complications is a really important thing. Likewise for the baby or babies that you may have, that is such a critical period of development for them. That's their first 3 months of life, and they are learning how to be out in the world after being born. And so they have a lot of check-ins with the doctor in that period to make sure they're growing appropriately and that there aren't any healthcare conditions that we're worried about. And then for the two of you or more, if you've had more together, it's such an important period for bonding and getting to know each other, for other family members, for everyone to kind of reestablish their roles in the family. If you're a first-time parent, you have to learn about this new parenting role. And so it's really nice to have the time to do that. Unfortunately, in that period, it is a period where people can still get pregnancy-related complications. And so that's a really important thing to be aware of. It's fortunately not something that everyone has, but it's a high enough chance that we want to make sure people are really aware of some of the complications that can happen after having a baby. Those include things like blood clots. Preeclampsia can actually still happen after having a baby. bleeding even after you go home from the hospital. And so frequent check-ins with your doctor about signs that you might be worried about are really important as well, to make sure that we keep your recovery on the right track.
Great. Thank you. Let's take a look here. Next question for Dr. Anyanwu. So here we have a question regarding a parent who's worried about postpartum depression. Can you talk a little bit about what are the signs that parents should look for, and when they should seek for help? When exactly do they kind of draw the line and say, okay, this is not baby blues, I really should be talking to someone about this?
Great question. And so it's normal to have a lot of emotions after having a newborn baby. Some of those are joy, excitement, it's such a celebratory period, but it can also include fear, anxiety, sadness as well. And so all of those emotions can be common after having a newborn baby. But when we start to worry, could I be developing something more serious, as if these symptoms or these emotions persist? And so if you're still feeling sad, if you're feeling very irritable, if you're having a lot of mood swings and difficulty sleeping, and it doesn't really go away after the first 2 weeks following your delivery, that could be a sign that maybe this is more than what we call baby blues. Maybe this is something more serious called postpartum depression. And so what postpartum depression looks like, and so you're having severe mood swings, increased irritability, feeling like, maybe you're feeling hopeless. Maybe you're just feeling so down, feeling guilty. Am I a good mother? All of these questions about your ability to take care of your child or your capabilities as a mom can be a sign of postpartum depression. If you're just overwhelmed with fatigue, low energy, anxiety, those can be signs of postpartum depression. Decreased interest. Maybe you're more withdrawn from your spouse, your partner, your friends, and your family. Perhaps you're oversleeping, or you're just not able to fall asleep at all. Sometimes women may say, oh, I haven't been able to eat for weeks, or wow, I'm overeating. I'm eating so much more than I used to. And so and then of course, if you ever have thoughts about, maybe I don't want to live anymore, thoughts about harming yourself or even harming baby. And so those are all signs and symptoms of postpartum depression. And so when do you notify your doctor? And so at any time point, if you're ever having any thoughts about harming baby or harming yourself, the first thing you'll do is find a partner, find a family member, make sure that baby's safe, and then you'll step away and notify 911. And that's if you're having any thoughts about harming yourself or harming your baby. And so when you notify your doctor specifically, that's if it's been 1 or 2 more weeks and these symptoms are getting worse, they're not getting better, you're feeling hopeless, or you're having thoughts about harming yourself or harming your baby. The good news is that there's therapies, there's programs, and there's also medication that can help treat postpartum depression. It's unfortunately when postpartum depression is undiagnosed or it's left untreated is when it can sometimes progress into full-blown depression. And postpartum depression is not just limited to moms. Dads, we know that you guys this is a new experience for both partners, or both moms as well, or both dads. And so anyone bringing a new child into their home certainly can develop postpartum depression. While we understand that this is a very new time, it's also a very challenging one. And so it's okay to step out and reach out to your provider or loved ones if you need some more hope or help, or if you need some more support.
Thank you. Yes, I think that is extremely important. And I really urge all parents to please, please, please be open. Talk about this. It's a lot more common than you can ever imagine. I had it. It's different with every pregnancy. It's certainly not the same. It doesn't matter whether you feel like you're an experienced parent or new parent. Please, please, please speak up and talk to someone, have the care that you need. It's like I said, something that people don't talk enough about, and it happens a lot more often than you think. And it is normal sometimes to have all these imbalances. And so there is help, there's treatment, and we have some amazing providers here and nurses that can take care of a lot of these symptoms that you may be feeling. So just be open. It's okay if you don't want to talk to anyone at home, but please talk to someone. Any of your healthcare providers can help you with just understanding on what exactly it is that you're going through. Okay. Great, thank you. Dr. Johnson, let's see. Next one is So there's a lot that's changing regarding COVID-19 and the restrictions are being lifted. How can parents politely tell certain friends and family members that they're just not comfortable with them seeing the baby, and how can they kind of go around that?
Yeah, tough question. I mean, especially even before COVID, people love babies and want to meet your baby and hold your baby, and that's not something every parent wants. Uh, and so there are a few strategies to try. One is, you and if you're partnered, you and your partner kind of make a choice about what you're going to be comfortable with and what you're not early on, and be really clear and really open with your family and your friends about that. If you do it early and you kind of make it as an announcement to a group, people tend to feel a little less targeted, like it's just them that you're saying no to, and just being really clear that it's just where your family policy line is for the moment, and when that changes, you'll let them know. The other way is making opportunities for family and friends to meet your baby that aren't up close and personal. So, video chat, I think we've all gotten a little bit more comfortable with on phones and computers over the last year. That can be a great opportunity. Some families will meet babies through windows, so they can still see and meet them kind of that way without having the infection risk. Another strategy can be, especially when you're out in public, which, sometimes you just need to go to the store or get some things done, is using one of those safe covers over the carrier or your car seat. Because if people can't see the baby, they're less likely to kind of try and get in there and get up close and personal as well. And then blame us, right? Just be like, my doctor, my nurse, my clinic said that, right now it's not safe. And, they'd get really mad at me if they knew that you met my baby. We'll take that. You can make us the bad guy.
No kissing the baby, my doctor.
No kissing the baby, not yet.
All over it. Thank you. Look here. Those are good questions here parents have. Dr. Anyanwu, how do you choose a healthcare provider for your new baby? And when should the baby's first appointment be?
Great question. And so there's a lot of different things that goes into choosing a doctor for your baby. And so one is proximity. Obviously, you want to look for a doctor that's close to you. Make sure that it's one that's covered by your insurance. If you have prior children, sometimes it's easier for parents to have the pediatrician or the family medicine doctor who's already seeing your other children see your newborn. Dr. Johnson and I actually, as we are both family medicine doctors, if you do happen to receive OB care or prenatal care from one of the family medicine doctors who provide this care at Thunder Miss, the benefit is that we can see you during your pregnancy, be there during your delivery, and then if you choose so, we can also now take care of your child. And that is personally one of the things that I like about family medicine, that it's so comprehensive, and we literally are involved in your entire family if you so choose so. And so it's a great way to just continue on with that care if you are so comfortable. If you do choose to continue your pediatric care here at Thunder Miss, there are pediatricians here as well. So these are doctors that are board trained or board certified in just children are from 0 to age 18. And so if that is your choice, you have the opportunity to establish care at that time. Typically, I do talk to my patients when they're about 3 to 4 weeks prior to their due date. This is the time to start thinking about the doctor for your baby so that you're not worried about it when you're going into labor and delivery. It is important before your delivery, typically within the first 1 to 2 days of life after delivery, that would be the time to call and schedule that appointment for your baby. On average, we typically see newborns within their first 3 to 5 days of life. But there are some instances when babies may come in sooner. If, for example, maybe we need to follow up on the weight, or maybe we need to check other conditions or follow up on some things from the hospital. But on average, it's within the first 3 to 5 days of life.
Thank you. And I'm glad that you mentioned proximity. So we do have 3 health centers, very beautiful state-of-the-art health centers. One is in Woonsocket, the other one's in West Warwick, and we have one in South County. So definitely go to our website and look those up and see how close they are to you. And hopefully we get to take care of you and your beautiful babies. We'd love to see you. So thank you for that. Dr. Johnson, why is it important for a parent and their children to see a provider even during the pandemic?
Yeah, I mean, pandemic aside, people's healthcare needs are still there, right? We spoke earlier about some of the really wonderful things that happen in this 4th trimester, but also some of the complications that can happen for moms and babies. And it's such a discrete period of time, right? The 12 weeks after you have a baby, or the first 12 weeks of your baby's life, is a time that we won't get back. And so really being connected with your provider in that kind of post-delivery period is really important so that we don't miss those critical things. Dr. Anyanwu already mentioned that one of the really important things in the baby's early weeks is tracking their weight. And what they mostly do is eat and sleep and grow. And we want to make sure that growth is happening the way it's supposed to. And that however you're feeding your baby, you're able to do that. If it's breastfeeding, that we can help you, establish that and troubleshoot if you're having any difficulties. And that if it's formula feeding, you have all of the supplies and the formula that you need. Again, with babies, we watch for things like jaundice and make sure that whether it's because of feeding issues or other issues, that they're not developing complications like jaundice. And then, those first 2 months is still in that period. And that's actually that first visit where they get their first vaccines of their own and their immune system starts to develop more robustly. And so we don't want to miss those really critical periods of time. The office, all our offices, any doctor's office or provider's office you go to is taking a lot of precautions right now to keep that space safe. We have really strict protocols with cleaning and masks. And so, there's no increased risk of getting exposed or getting infected by coming in. So please don't let that be a deterrent to you.
Thank you. All right, parents. So babies are, very delicate. They fluctuate quite often. You don't need to know what exactly you should be looking for. We have amazing people here that can look at your baby and to get all the necessary information to make sure your baby is healthy and prevent any complications that we don't want. So bring those little sweet things. We want to see them. So we appreciate you being very cautious and bringing the babies. We are doing the best we can in keeping our area nice and clean. And it's a safe place for the baby, for parents, and we really want to make sure that the baby is okay. Those are very important days of their lives, and so we want to make sure that we're here for you to support you through that.
Yeah, and I'll add, actually, I just realized, for some parents who may actually be giving birth at a time where you may be diagnosed with COVID, we do have ways to keep you and your baby seen and safe and protected. So don't let that keep you from coming in either. We are here to serve no matter what.
Thank you. All right, one more for you, Dr. Johnson. So let's see. When should you start talking to a provider about family planning following the birth of your baby? When is it?
Well, that's kind of a trick question because actually the best time to start is before you even have your baby. So we do typically during the course of your pregnancy start having those conversations, just so, again, you don't have to decide anything at the last minute. There are a lot of options, and some of those options are things that we can start. Or even for people who want something like a tubal ligation, we can offer that during the same hospitalization for your pregnancy if we're prepared ahead of time. So we start having those conversations, often in the 3rd trimester of pregnancy as we're getting ready for the delivery and the hospital period. depending on what your preference is, you may not start something right away, however. And so that may be something that we continue to talk about into the postpartum period and end up actually starting whatever your preferred option would be in the postpartum period. One of the reasons we talk about this at all and why it's so important is that we know that for subsequent pregnancies, for your next pregnancy, allowing a little bit of time for your body to recover and get ready to support another healthy pregnancy is really important. And so if somebody has a pregnancy within 6 months of having a baby, there tend to be a little bit more complications because your body still hasn't made that full recovery and gotten all the nutrients and minerals, and it's not as ready to support another full pregnancy. Generally speaking, we know that having babies anywhere from 18 months to 5 years apart tends to be something that we see helps moms have a healthier pregnancy for the next one. And so with a plan for family planning, whatever that plan is that fits into your life, that can really help you decide when and if you want to have the next baby join your family.
Great, thank you. All right, Dr. Anyanwu, does Thundermist offer postpartum care? What should they expect if we do?
Yeah, so Thundermist actually does offer postpartum care. I like to think of postpartum care as kind of the end of this 9 to 10 month journey between your OB provider and yourself as the patient. And it's a great time, and also for me as a provider, it's such a joy to be in this experience caring for patients during the prenatal time, even if I'm not involved in their delivery. And so just the postpartum course is just, or the postpartum care, or that visit is just a great time to discuss the labor, talk about your experiences. Sometimes there just can be a lot going on, and so we can get a chance to just slow down and discuss more in detail. And it's just a great opportunity to ask any questions that maybe have been left unanswered or you thought about later at that time. Essentially, the postpartum visit is just this comprehensive visit of seeing your physical, emotional, and just your social well-being since the delivery. And so we do that in a number of ways. And so first, as Dr. Johnson mentioned, there are a few medical conditions that some women can develop following delivery. And so during that time, we'll certainly screen for those things. And so some of those do include preeclampsia. So those are disorders of elevated blood pressure. Sometimes women can develop thyroid disorders as well. We want to make sure and assess the bleeding. Are you still having vaginal bleeding? Is it more than usual? Is it more than bleeding? Are you having any changes or discharge? Are there any signs of infection? All of those things will be important to assess and determine why you're there. Did you have a little bit more blood loss than expected during your delivery? If you did have it, we'll be sure to make sure you're being treated for that anemia, follow up and do blood work at that time if needed. Additionally, we want to check the social status. How are you doing at home? Are you getting enough support? Do you feel safe at home? All of these things will be important to discuss during your postpartum visit. And please know that your visits, any relationship with your doctor is always confidential. And so if there was ever a time that you didn't feel safe at home, that's a great chance to talk to your provider discreetly during that time. We'll also assess your feeding at that time. It's a great opportunity to ask your provider any questions about breastfeeding or formula feeding as well. If you had an operative delivery, we can check your incision, so the site where they delivered the baby through your abdomen. If you had any tears vaginally, the required repair, that's also an opportunity to check to make sure you're healing well. If you were due for a pap smear or a cervical cancer screening, that could also be an opportunity to complete it at that time. And then lastly, I typically discuss contraception with my patients at that time. If you didn't receive contraception during the hospital, but if you're wondering, Doc, what are some contraceptions that I can use while I'm breastfeeding? Or, I'd like to talk to you about this. It's just a great opportunity to answer any of those questions. And then from there, typically that's the end of our relationship, unfortunately, unless you're staying on and you were being treated. If your OB provider was also your primary care doctor, then you'll definitely continue to see that doctor on a regular basis. Otherwise, we'll see you annually and as needed for your women's visit and your wellness visit. And so, that's usually my farewell, and it's always a pleasure taking care of patients and their babies. And don't be afraid to bring your baby to your postpartum visit as well, because I want to see them out and all those exciting things. And typically, postpartum visit consists of in the past, there were recommendations that at the very least, you should see your doctor by 4 to 6 weeks. But now, at least by 3 weeks following your delivery, ideally, we'd like you to touch base with your doctor, if not in person, then on the phone. But at the latest 12 weeks following your delivery, it'd be expected you'll have a full comprehensive visit, so including a physical examination, vaginal exam if needed, and blood work if needed.
Thank you. So much going on. It's so nice that you guys are talking through us, with all this information. I feel like I learn something every single time, we have these conversations. There's so much going on, so many new things, good new things, bad new things, just new thing changes. Changes can be good, hard, bad. So it's so important that, we take care of ourselves, we take care of our babies, we take care of our families, and we have so many different resources and support here for you and your loved ones. So please keep your appointment, schedule your appointment, keep your appointment, come see us. We want to see you. We want to see your baby. We want to do the best we can to support you and your family to have a healthy relationship and a healthy lifestyle. Okay, well, thank you so much, guys. Let's see. So let's take a peek and see if we have any questions. Those are all the questions I had, the most common questions here. Let's see. I don't have any new questions here. Okay. All right, so that wraps it up. So thank you, everyone. We really hope that you enjoyed all the things that we had to provide you as far as information. Please enter to the raffle. We have some goodies for you to win. So please be sure to kind of follow that link that's right on that comment box. We have some wonderful providers here that we hope that you got to know a little bit more about. We have some great sponsors who made this happen, and we are so grateful for you to be part of this. This session is recorded, so in the future, if you want to watch this or you have someone you love or someone you care about who would kind of benefit from this conversation and a little bit of this education piece, please feel free to share it. You do not need to have an account to be able to see this video. So we just want to thank one more time Neighborhood Health Plan of Rhode Island, United Healthcare Community Plan of Rhode Island, Tufts Plan, Landmark Medical Center. For these folks have generously sponsored these series, and this is the fourth one. So we really appreciate all the support you've given us to be able to provide parents and their little babies some support. If you need any prenatal care or any primary care, ThunderMist does offer services for all ages, and it does not turn anyone away, even if you don't have the ability to pay. Okay, very important. We are here to see everyone. Please call at 401-767-4100 to schedule an appointment. And as well, we also have COVID vaccines available if you're interested in that. And you do not need to be a ThunderMist patient to be able to get this vaccine. So please call our number 401-767-4100 to schedule your appointment. Thank you so much.